someone you love is suffering, whether emotionally or from pain, because of a disease such as cancer, would you want to help them or let them continue suffering? So, physician-assisted suicide is getting bigger as states such as Washington, Oregon, and recently Vermont legalizing it. It's important to be informed and to learn what it is because California could be next to put it on the ballot. People have the right to end their life on their own terms, whether they're in pain or have a terminal illness. And hopefully by the end of it, you'll understand why it should be legal. I will first talk about why people choose assisted suicide. Then I'll talk about assisted suicide and religion, and then the patient's state of mind at the end. So why people would choose it? To avoid the pain, suffering, and terminal illnesses. If you have a terminal illness, well, in order to, qualify for physician-assisted suicide, you have to have a terminal illness with less than 6 months left to live. And a lot of people don't want to go thinking, or they don't want to spend the rest of their short time left thinking about when that day is going to come. And they'd rather end it when they're ready and on their own terms. And also to avoid the pain and suffering. So according to John Grohol, a psychologist, physician-assisted suicide is for those who are at the end of their lives often in unbearable pain. They'll often choose it before they start feeling the pain that comes along with many diseases and even the treatments such as chemo. Angela Morrow, an RN and dying grief expert, says that an estimated 40 to 70% of patients die in pain and another 50 to 60 die short of breath. Physician-assisted suicide can lower those numbers. So now I will talk about religion-assisted suicide. Now, a major argument against assisted suicide is that it goes against religion. They say that God should be the one to end your life. However, we try and prolong our life. We say that we shouldn't go against God's choice, and if it's our time, it's our time. But if you take pneumonia, for example, if you don't treat it, you could die, and that's like God saying that's your time, yet you take medication to prolong it. And according to Craig Patterson, the author of Assisted Suicide and Euthanasia, both actions can be said to interfere with God's will, and you have to apply it to both cases. You can't just take one instance and apply to one and not the other. Now, the other is not everyone believes or follows a religion. It would be unfair to them if a few group of people say it's against religion. So, the whole argument against religion wouldn't even apply to them. So now that I talk about religion, I'll talk about the mental state of the patients and if they're even capable of making the big decision. This is another argument against it, but in order to do the assisted suicide, you need two physicians. They need to confirm the diagnosis, and you need to orally ask them for it, and they have to be within 15 days apart. You also must sign one written request with two witnesses. And then people say, well, that's easy to do, but what if you're depressed or sad? They can easily lie. Well, if the doctor is questioning their mental state, they can subject them to a psychological evaluation, and if they fail, they'll do counseling. So now that I talk about the mental state, I'm going to wrap this up. So in conclusion, I gave you reasons why we should legalize physician-assisted suicide. I first talked about why people would choose it. I talked about the arguments against religion and then the patient's state of mind. I hope you guys have learned why it should be legal, and it's better to have the choice and not choose it than wish you could but not have the choice.